Hello, hello. Okay, I want to make sure that my sound is live and that everybody can see me. So if you're on, you can hear my sound, you can see my screen. Go ahead and raise your hand, and that way I can go ahead and proceed forward and make sure that everybody is with me. You can either raise your hand or you can jump into the chat room and and just let me know if you're hearing me. So okay, looks like we're live and everything is going well. So good evening. This is Dr. Osborne, and tonight we're going to talk about chronic autoimmune pain, how to recover, how to overcome autoimmune pain, and a number of the different topics that I've recently written about in my new book, No Grain, No Pain. So I want to open up the conversation just talking about some of the fundamentals of autoimmunity. I think if everybody understands some of these basic fundamentals as we move forward, you'll have a better idea at the end of this webinar as to how to go about, one, searching for a doctor who's local to you, who might be able to help you. Two, now what you need to be able to look for in a doctor, and three, what kinds of tests, what kinds of fundamental basic premises or tenets that you need to be investigating to discern where the origin of your autoimmune disease is coming from. So as we start with basic fundamentals, I want to talk about the four basic fundamentals of autoimmune disease. There's really only four known causes for autoimmune disease. And so the first one, the one that's probably the most well-studied in all the medical literature and all the research, as well as clinical research, is actually gluten. Now, it can go deeper than gluten. Gluten is just the most well-studied. And so food as a general category, we should put as a priority for investigating in terms of where autoimmune disease comes from. So we have food as one potential, and I'm going to do some drawing here as well tonight as I answer some of the questions. So category number one is food. Category number two is chemicals. Now, environmental chemicals, and this could be pesticides, this could be herbicides and fungicides, this could be petrochemicals, this could be things that you find in cosmetics, or a number of different chemicals in our environment, food dyes, food additives, that we can get exposure to that have the ability to help trigger autoimmune disease. Probably one of the more common and most well-studied has to do with heavy metals, things like mercury and cadmium and arsenic and lead as heavy metals in the body. So food and chemicals. Category number three that needs to be ruled out is the potential for infection. And there are a lot of different forms of infection. Some doctors will look for infection in very, very general basic manners. They'll run, an example of this might be to run a complete blood count type of test, which is a type of lab test. And they're looking at the white blood cells and the different types of white blood cells and their ratios and concentrations. And so sometimes abnormalities in these ratios and concentrations of white blood cells can be significant in terms of identifying or helping to identify an infection. But so we're talking about viral infection, we're talking about bacterial infection, we're talking about prion infection and parasitic infection. We're talking about the potential for yeast overgrowth or mold or fungi. So those are all things that, again, can trigger autoimmune disease, can contribute to autoimmune disease. And anyone with this type of condition wants to have, again, a doctor who can rule out food, chemicals, and infection. Okay, and then we have one more category, and that category is something really near and dear to my heart. It's, you know, what actually originally got me into functional medicine, and that is nutrition. And so it's not so much nutrition as a broad category, but it's nutrition in the term of what causes autoimmune disease as it relates to nutrition. And the answer that we have there are micronutrition or micronutrient deficiencies. So an example of this might be vitamin D deficiency. We know vitamin D deficiency can trigger autoimmune disease. Zinc deficiency is another one that it's very well studied as a contributing factor in autoimmune disease. Vitamin C deficiency can contribute to autoimmunity and make it worse. So again, we've got about 40 different essential vitamins and minerals, and so looking at those to see whether or not a person is deficient in those particular things becomes a very, very important part of the clinical investigation piece. So again, food, chemicals, infection, and vitamin and mineral deficiencies. If you have autoimmune disease and the subsequent pain that relates to autoimmune disease, and you haven't had a doctor comprehensively investigate and rule those things out, and what's important to understand, ruling those things out simultaneously, not one at a time, not this year we'll look at food, next year we're going to look at chemicals, and then we're going to look at at other things. You have to have it done simultaneously because these things interact with each other. So it's one of the scenarios that I see very frequently is a person comes to see me in my clinic. Maybe they've already been tested for an autoimmune disease, and so they're already diagnosed. They come to see me, and they've actually been tested for food allergies. And so they say, okay, last year I got tested for food allergies, and so I changed my diet and I felt a little bit better, but I never really got better. And one of the reasons why that happens is because they didn't just have food allergies. They had food allergies, but then they also had some of these other issues as well that didn't get addressed. And so understand that each one of these things feeds in to each one of these things. So you got arrows diverting from one to the other. In essence, eating the wrong food can make your body less capable of detoxifying chemicals. So eating the wrong food causing inflammation can make you less available, make your liver less available to detoxify chemicals. Having an infection can cause vitamin and mineral deficiencies. Vitamin and mineral deficiencies can make you more susceptible to chemicals. Having vitamin and mineral deficiencies, especially something like L-glutamine or zinc or vitamin A, can make your gut develop a permeable or a breach in the barrier, so you can develop a leaky gut problem, and that makes you more allergic to food. So if you're chasing these one at a time, and a lot of people, again, I say that because so many people come to my clinic and they've already had several of these things chased in piecemeal, but you can't functionally address somebody's concerns and health long term and get them better without simultaneously looking at these issues and addressing them at the same time. Very, very important that you understand that. If you go see a doctor and all they want to do is look at food allergies and they're not looking at anything else on this list, then find another doctor or talk with that doctor, have that doctor, hopefully that doctor will be educated and will have a background knowledge on how to test for these things. Obviously that's the ideal scenario, but you don't want to piecemeal this. I get patients from all around the world in my clinic, and largely they've been to 8 or 9 or 10 doctors, and the reason they're even in my office is because the 8 or 9 or 10 doctors that came before me were not diligent, and so that lack of diligence is really what brought them to see me in the first place. Okay, so I'm getting some feedback. I want to make sure again that everybody is hearing me. It looks like some people have sound and some people don't. So again, if you're still having trouble with sound, go ahead and just chime in and let me know, and I'll see if my tech people can get on that and get that fixed for you. But otherwise, I think the vast majority of you should be hearing sound at this point. So anyway, again, this is a kind of a precursor to what needs to be investigated. And again, if you haven't had that investigated and you've been diagnosed with an autoimmune condition and you continue to suffer, these are the 4 fundamentals that need to be looked at first. If they're not being looked at, you've got a problem, and you need to have somebody who's aggressive in being able to investigate that. So I'm going to start a little bit of this off with, let's load. I'm going to load up. I would like to get feedback from all of you, because I want to really cater this event and this evening toward the types of problems that you're having. So what I'm doing is I'm just loading up. What you're going to see in your sidebar there is you're going to see a little poll. And if you'll just go ahead and take a moment to fill that out for me. What I want to know is I want to get a feel for, what the vast majority of you are dealing with, so that I can, again, help cater to you guys in particular, make sure that we can get as much answered this evening as we possibly can. So I'll give you a couple minutes to fill that out. And while we're waiting, let's talk about one of the concepts from No Grain, No Pain. Many of you probably already ordered your book, but if you haven't yet ordered your book, hopefully you'll be getting it. And anyway, I want to talk about one of the most important concepts that coming out of that book, and it's the concept of gluten. And so many people that have already gone gluten-free, they've been instructed to omit wheat, barley, and rye from the diet, and understanding that wheat, barley, and rye are classically the grains that most doctors considered to contain gluten. And this is probably one of the biggest drawbacks to a lot of people's health. And the reason why is that a lot of people who go gluten-free gravitate toward eating a number of other processed foods, the corn and the rice. These products generally, the breads, the pastas, the cereals with corn and rice, or millet, or sorghum, or some of these other grains that are being labeled as gluten-free, including oats. And what the science says on this topic is that a person with gluten sensitivity who goes on a traditional wheat, barley, and rye-free diet doesn't recover from autoimmunity. As a matter of fact, the science shows that up to 92% of all of these people have continued immune dysfunction, continued inflammation, and continued gastrointestinal problems, and the sequelae thereof. So it's important to understand, again, one of the concepts we talk about, and the reason why the title of the book is not No Gluten, No Pain, and it's No Grain, No Pain, is because what I want you to understand is that all grains, to a certain degree, have forms of gluten. And so those forms of gluten, and when you're reading a food label, and you want to understand that those forms of gluten aren't all the same. So when you're reading a food label that says gluten-free, it's really not referring to gluten as the family of proteins. As we say, we have to define gluten. Gluten is defined as a family of proteins. They're storage proteins. It's a family of proteins, storage proteins, found within the seeds of grass. So again, gluten is not one protein, although it's oftentimes used interchangeably with a particular protein, and that protein is oftentimes referred to or called alpha gliadin. And so, when you're talking about celiac disease and some of the research that was done in the early 1950s and 60s, alpha gliadin is the name of one of the types of glutens found in wheat, barley, and rye that was accused of causing celiac disease. But today we know better. We know that alpha gliadin is not the only form of gluten, and that there are over 1,000 different forms of gluten, and they're in all grains, because by definition, remember, gluten is the family of proteins found within the seeds of grass. The seeds of grass are grains. So corn is a grass, and rice is a grass, and millet is a grass. And so what you've got different kinds of glutens found within each different type of grain. Alpha gliadin is only found in wheat, barley, and rye. To give you an example of the scope of inaccuracy and understanding for most people, is that in 2010 there was a study done. It came out of Australia, and in this study there were 400 new proteins, new glutens identified, 400 new ones that were identified. Now, prior to that point, everybody's really kind of honing in on alpha gliadin, and what they found is that 40 of the 400 new gluten proteins were actually more toxic than alpha gliadin. And so again, it goes so much deeper than just wheat, barley, and rye and alpha gliadin found in wheat, barley, and rye. And again, that's one of the reasons why I wrote the book, was to lay out and map out the science behind this. There's gluten in corn, there's gluten in rice. The gluten in corn and rice, the gluten in sorghum aren't alpha gliadin. Again, people oftentimes will use alpha gliadin and gluten as synonymous terms, and that's where a lot of that confusion comes from. What I want you to understand is alpha gliadin is a form of gluten, but gluten as a whole is a family of proteins found within the seeds of grass. So if you've been diagnosed with gluten sensitivity and you've been told to go on a gluten-free diet and you're continuing to have persistent issues, one of the first things that you need to investigate and potentially do is look at where you're getting grain in your diet, because if you're getting grain in your diet, you're getting different forms of gluten that can potentiate inflammation and autoimmunity just as aggressively as wheat, barley, and rye. And that includes oats, and that includes any product that says certified gluten-free. You have to become a label reader, read the label, and make sure that what you're looking at, okay, is grain-free. Now, the most common grains that you're going to see in the U.S., wheat, barley, rye, oats, corn, rice, millet, teff, triticale, sorghum. Those are probably the most common, the ones that are used. Many of those used on in quote-unquote gluten-free food products. And again, don't get fooled by that label. That label in the U.S. was just signed into law in August of 2014, and it only includes wheat, barley, and rye. So by law, a manufacturer of a product can call it gluten-free if it doesn't contain wheat, barley, and rye down to 20 parts per million. So that's where that labeling law that's what it means. It doesn't mean corn-free. It doesn't mean rice-free. So if you're still suffering and still having chronic issues, one of the first things I want you to do after you leave this webinar tonight is I want you to go and evaluate where in your diet you're getting potential other forms of grain or grain byproduct. So that's a major concept. You can walk away with that information tonight. You'll have walked away with, I think, a very valuable piece of information that might just help turn your situation around. So getting these poll results back, what type of pain do you deal with the most? It looks like the vast majority of you tuned in tonight, 24% of you, 25% of you have selected arthritis. And then coming in second is gastrointestinal pain, and then muscle pain behind that, and then a combination of nerve pain and chronic fatigue and brain fog. So let's kind of talk about some of those concepts and how that works. There's a process for a lot of people with joint arthritis and joint problems. One of the main reasons that happens is this process called molecular mimicry. And so I'm going to draw you a picture. This is just kind of a cross section of the GI tract. So think of the GI tract as a tube that runs from the mouth to the anus, but the GI tract itself is lined by a single layer of cells. Okay, so again, imagine this is two-dimensional, but imagine a three-dimensional tube. And the cells that line this tube three-dimensionally, it's a single layer of cells. And in between these cells, there are these tiny anchoring proteins that hold the cells together. There's a lot of people are very skeptic when it comes to joint pain. They say, the food I eat doesn't cause joint pain. How does that happen? It's, I can see where it could cause gut pain, but how can it cause joint pain? And that's what I want to explain to you. I want you to understand. So, imagine food's coming in, and so you have the GI tract lining and you have the cells, and on the surface of the cells, let me use a different color here. On the surface of the cells, you have a layer of mucus that is secreted. There's specialized cells within these cells called goblet cells, and one of their jobs is they secrete a layer of mucus as a physical barrier, physical coating or protectant. And then on the mucus, on and in the mucus, you have bacterial colonies. And so think of the bacterial colonies, oftentimes referred to as probiotics, but these guys are the, in essence, what they are is they're the microbiome. So your body is actually outnumbered 10-to-1 bacteria to human cells. So the microbiome, extremely important. These little proteins in between the cells are called tight junctions, and they are what their name implies, in that the so we'll call that number one. We'll call that number two. These tight junctions are what they apply, in that they hold the cells together. If the cells don't have a strong tight junction protein, what you get is you get a gap in between the cell, and so that gap is a dangerous thing. And this is what you probably heard other people refer to the situation known as leaky gut. So what happens is the contents of the GI tract kind of leak through those gaps, and that's what we refer to as leaky gut. Now, something else that you want to understand, behind, so this is one and this is barrier, we call these the barriers of the GI tract. This is barrier number one. The microbiome is barrier number two. The mucosal barrier, which is this layer of mucus, that's barrier number three. We'll call that mucus, but inside that mucus you make antibodies, and one of the antibodies you make is called secretory IgA, or SIGA for short. It's a very important antibody that helps fight infection. So if you accidentally get exposed to a virus or bacteria or something, these antibodies work like handcuffs. They bind those things and they prevent them from leaking through and stimulating a problem. Now, behind your gut wall, okay, you have another part of the barrier, and this is called the GALT. And GALT is an acronym that stands for gastro-associated lymphoid tissue. Think of the GALT as you might think of tonsils in the back of the throat. The GALT are tonsils of your intestines, and so 70% of the entire immune system is your GALT. Okay, 70% is right there right there in the small intestine. And it's very important to understand that your body is smart enough to know that it needed to concentrate 70% of your entire immune system behind the gut wall, because the act of eating in and of itself, we've turned it into a social grace, but it's actually, eating is a war. It's a form of warfare. It's your gut against your food, and your gut has to win that battle. And it has to, in that battle, it's a battle of extrapolating nutrients from the foods you eat and excreting waste and dangerous chemicals so that they can't get into your body to create damage. So if your gut is healthy and these four barriers, again, tight junctions, microbiome, the mucosal barrier, and the gastro-associated lymphoid tissue or gall barrier, if those four barriers are largely intact, then you've got a pretty healthy small intestine. Now, there is one other barrier. We'll call it barrier number 5, and that barrier represents stomach acid. And these again, there are more barriers than these 5, but these are kind of the 5 primary barriers that you absolutely need to be aware of. So the stomach acid is extremely critical, because the job of acid, there's multiple jobs. One of the jobs of your stomach acid is to kill infections. So when you eat your food, if there's virus or bacteria or parasite or anything else you might get exposed to, the acid does a lot of the killing before that food gets down into the small intestine. But the other thing about stomach acid is it's necessary for you to be able to digest and absorb protein. So if you remember that protein is the backbone of all your antibodies. So if you're protein malnourished because your stomach acid's been suppressed, your immune system starts to falter because it doesn't have enough protein to pull from, and therefore you can't make antibodies in an adequate fashion, and you don't have the tools to fight. So stomach acid is important for protein absorption, also necessary for vitamin B12 and calcium and magnesium and zinc and vitamin A and vitamin B2 absorption. So if you're blocking stomach acid, you can see where that could potentiate into a very, very big problem nutritionally, which can lead to secondary and tertiary problems down the road. So we've got these 5 barriers. Let's talk about, I'm going to get to the point about arthritis in just a minute. So bear with me. I really want you to understand this concept. But these 5 barriers, if they're intact, we're going to have a healthy digestion. We're going to have a healthy gut. But if these barriers are breached and we've developed an intestinal permeability, then what happens is the things that leak in, they leak into the immune system. They leak right into the gall. And so over time, and these are a variety of different chemicals. It might be bacterial proteins. It might be viruses. It might be agents in the food, like chemicals that are in food or dyes in food that are leaking into 70% of your immune system. So initially, the immune system is just trying to defend you from the things that are leaking in. But over time, the immune system, it becomes overly aggressive because it's always on. It's always having to do battle. And over more time, some of the things that leak through, some of these proteins, actually resemble or look like cartilage. So they actually look like your joints. And so what happens is your immune system is always on, and it's always battling these things leaking through the gut. And if these things resemble the cartilage in the joint tissue itself, and this is true for muscle, this is also true for nerve tissue. So those of you who have neurological neuropathy or chronic muscle pain or fibromyalgic-like symptoms, this is also true of those situations as well. The process that occurs is called, the name for that is called molecular mimicry. And this is not a new concept. Most people haven't heard of it, but it's not a new concept. It's been around for over 20 years, actually over 30 years. And so what happens is the molecules that are leaking through mimic your own internal tissues. And because your immune system has been so busy attacking those molecules, and those molecules mimic your internal tissues, the immune system then starts looking at your tissue and saying, hey, that tissue looks like a bad guy too. Let's go attack it. And then the immune system will start to create antibodies against your joints, antibodies against your nervous system, antibodies against your blood-brain barrier and your brain tissue. So it can contribute to and create an autoimmune response in virtually any tissue of the human body. And the gut is, for people with gut pain, it can happen here first. But once those barriers are breached, all bets are off. Now we have systemic access. So these molecules and that mimicry can occur systemically, and that leads to a barrage, a battery of different types of symptoms in terms of autoimmunity. And that's why, honestly, there are over 140 different forms of autoimmune disease. There are over 46 million cases of autoimmune disease diagnosed in the US alone, but it's speculated that more than 100 million people actually have a diagnosis, or 46 million have a diagnosis, 54 million don't have a diagnosis but need a diagnosis, but they have an autoimmune condition. So 100 million people with autoimmune disease, that's almost a third of the country suffering with a condition that at its root can stem from this entire process right here. So I want to back up for a minute. This is another important concept to understand, is that what breaks these barriers down. So you've got, the tight junction, the microbiome, you've got the mucosal barrier, you've got the galt, and you've got the stomach acid. So if we look at what breaks these barriers down, one of the things that we know breaks these barriers down, particularly tight junctions, we know gluten breaks open tight junctions. Gluten damages tight junctions. There's a nice diagram in the book I put out, No Grain, No Pain, and there are about 11 different causes of tight junction disruption that we know of in research, and gluten is one of them. Other food allergies can trigger it as well. We also know that plastics and pesticides can trigger this. We know that antibiotics can help trigger this. We know that there's actually some very new interesting studies coming out about temperature of food. So, and before you dive into that too deep, I didn't write much about this in my book because I don't want to be an alarmist. So I'm really waiting for more research, but there are some studies that show that temperatures, hot beverages and temperatures as they get too hot, so like food that's too hot, can actually open up your tight junctions and cause a kind of a temporary or transient leaky gut as well. So just things to be concerned with. Then we have the microbiome. Of course, we've got antibiotics, and if you don't take an antibiotic, so taking an oral antibiotic can create a disruption of your microbiome for up to a year. A study just published in November confirmed that. But the other aspect, even if you're not taking antibiotics, if you live in a major metropolitan area, like here in Houston, in the Houston area where I'm at, it was shown a couple of years ago, there were 42 prescription medications identified in our drinking water, our tap water, and multiple types of those medications were antibiotics. Now, the other big aspect where you might get antibiotics, the other big source you might get antibiotics, is going to stem from, or is going to come from, eating meat. And that doesn't mean go be a vegetarian. What that means is don't buy processed farm, industrialized farm-based meats. Now, because the largest buyer of antibiotics in the U.S. are these types of farms, and there's more antibiotics in those forms of meat. And so as you eat that kind of meat on a regular basis, you're getting regular exposure to antibiotics. You're knocking out your microbiome on a regular basis. So it's very important that you select meat that is not raised with antibiotics, not injected with antibiotics. The feed doesn't contain antibiotics. In essence, you want grass-fed, free-range, organic when you're selecting your meats, or wild-caught. Now, this mucosal barrier, here's one of the biggest ironies for those of you with pain. If you take pain medication like non-steroidal anti-inflammatory drugs, and I call this the prescription pain trap, because you start taking these medications to block the inflammation, to reduce your pain. But what actually can end up happening is those drugs erode this third barrier. They actually erode your mucosal barrier. So they form pockets of erosion, and they predispose the cells underneath to the chemicals, and so then the gut cells can become damaged a little bit more aggressively, and that can trigger or help to trigger this whole leaky gut process. So taking those types of medications now strip away the mucosal lining, and they do it both in the stomach, so it can lead to stomach bleeding and stomach ulceration, but they also do it in the small intestine. So it's important to understand that even aspirin, even enterically coated aspirin at doses as low as 7.5 milligrams, and by the way, baby aspirin's about 85 milligrams. So 1/10 of the dose of a baby aspirin can cause gastric bleeding by eroding this mucosal layer. So if you're a chronic user of those types of pain medications, you really have to be careful, because you're setting yourself up for a vicious cycle that will never end by eroding that third barrier. Now, if we look at the stomach acid, we know that stomach acid, that barrier for many people is disrupted, because a lot of doctors will prescribe antacid medications. A lot of people will take over-the-counter medicines for acid reflux. So examples might include Tums and Rolaids and Mylanta and Pepto-Bismol. Those are things that will stifle your stomach acid. But then there are also drugs like Prilosec and Tagamet and Zantac and Nexium. These medications will hinder and block your stomach acid production. So using those for any length of time again, is going to set the stage to breaking that fifth barrier and leave one of your primary barriers in your GI tract compromised. And again, the more of these barriers are compromised, the faster you develop leaky gut. And so one of the common stories I get from my patients, in the clinic is, I had an infection this year. I was on an antibiotic, but I also have knee pain, so I take ibuprofen, 2 or 3 times a week. And so again, those two different types of medications have eroded 2 of the main barriers. But then that patient might also have food allergies or gluten sensitivity, and so now we're disrupting even more barriers. And so it sets the stage. Once the barriers are breached, the floodgates are open, and autoimmune disease sets in a very, very big way. And so you might go 3, 4, 5, even 10, 15 years feeling just fine doing some of these things, but when your body can no longer keep up with the damage to those barriers, and what ends up happening is that permeability breaks open, and now you end up with a systemic autoimmune process that can morph and migrate. And understand this: a person with one autoimmune disease, if left untreated and left unrecognized as far as the cause, on average will go on to develop 7 autoimmune diseases in their lifetime, and on average will live 26 years less life than their peers who don't have autoimmune disease. So this is one of those things that younger people may not see it as crucial and critical to make changes today, but as you get older and start developing it, it will shave decades of your life, and it can become a very, very serious scenario, a very serious situation. So again, understanding that concept is very, very important. And again, going back to why I started that conversation had to do with the process of molecular mimicry. And again, molecular mimicry occurs when the chemicals that are breaching your gut barrier look like your own body's tissues, and your immune system starts to attack your body because those things that has been attacking, that have been leaking through, again, have that mimicry. There's a mimicry going on, and you create a mimicking inflammatory response as a result of it. So you can do a nice scholarly Google search on molecular mimicry if you want to learn more of the technical science behind it. But I think it's one of the most important concepts to understand if you're trying to overcome pain, autoimmune disease, and you've struggled and not been able to do so. And again, this process to seal the gut and to put an autoimmune disease in remission can take up to 18 months and as long as 3 years. But going back to what I started this conversation tonight about, which were those 4 primary things that can trigger autoimmune disease, that's the way you get to the root, is you have to investigate those 4 primary triggers first. Because if you're not investigating those 4 primary triggers, it doesn't matter what you do. You're going to be spinning your wheels for a very, very long time. Okay. I'm going to start with some questions now, and then we'll get into a few more concepts. So one of okay, this question's coming in from D. D asks, high secretory IgA on a stool test, how do you address it? Well, I think more importantly, it's not how you address it. It's asking the question, what's causing it? Typically, high secretory IgA on a stool test is a marker that you either have an infection or that you're reacting to things that you're putting in your mouth, things that are in your gut, and your immune system is turned on. It's ramped up production of this particular antibody. And so what's happening is it's not necessarily something you treat. It's something you treat why it's high, but you don't treat secretory IgA. So if it's infection that's causing it, you have to go after the infection. If it's and that there's a number of different ways to go after the infection. It just depends on the kind of infection. So part of that follow-up with that high SIgA is actually trying to determine what kind of infection you have. For those of you who can't see number 5, it's stomach acid. I'm going to write it in a little darker for you. Okay. Hopefully that helps. Been gluten-free for this, coming from Chris. Been gluten-free for 3 years. This past month I stopped all grains, but now the last 3 weeks I have daily stomach acid pain. Will this acid reduce after a time of the adjustment? Chris, you stopped all grains. I congratulate you for taking that big step. You really probably ought to have some testing done to determine what else might be going on. You might be having, you might have an ulceration. You might have an infection in your gut. One of the more common ones that causes acid reflux-like symptom is an infection, a bacterial infection called Helicobacter pylori. Of course, yeast overgrowth can create or contribute to that as well. I would have somebody run a stool sample on you to see if you can culture out, and the type of testing that you want to do with the culture of the stool sample like this is called a MALDI-TOF, M-A-L-D-I-T-O-F. MALDI-TOF, it's a technology that is much more accurate than a traditional stool test. And anyway, you want to have that kind of test run to see if there's an infection there that's contributing to that. Beyond that, you might want to look at other potential for other food allergies. A lot of people that are gluten sensitive and have been eating gluten for years and years end up with a problem with other food allergies because they've broken a hole in their gut and their body becomes overreactive to other foods over time. So those are all issues that you might want to consider. Next question coming in from Kimberly. Requested tests for intracellular vitamin and mineral deficiency. Probably one of the best tests in the world to run to look at, if you're looking at intracellular, there's only one test in the world that really looks at that, and that test is called a SpectraCell. You can check those guys out at spectracell.com. It's an excellent test to look at. There's about 35 different vitamins and mineral analysis that is going to come out of a test, a comprehensive panel from that particular lab. But if you're wanting even more comprehension, then you have to add on other labs. So I would actually add on a 25-OHD. I would add on an iodine loading test. I would add on an iron and ferritin panel. And then you might also look at homocysteine and methylmalonic acid as several other markers that could be helpful as well. Reverse T3 as well. So those are just some other markers that can help us to help identify nutritional deficit. Is there an easier method than that? Let me see if I understand that question properly. No, I don't think that question is accurate. So I'm gonna move to the next one. Hopefully I answered the first part of it, which should help you find the right lab. What about somebody having H. pylori? This question coming in from Lori. Does that conflict with the stomach acid issue? It can, because H. pylori can mimic gastroesophageal reflux, because what happens with the bacteria is they bore holes in the mucus layer, and it's so people feel like they have acid reflux. They don't actually have acid reflux. They have an erosion of their mucosal layer. So as they're making a normal amount of acid, there's no protection from that acid. So that acid is actually damaging the cell below the mucus. And so with those types of scenarios, there are a number of things that you can do. One, you have to get the H. pylori treated. So there are a number of different botanicals that can do that. But beyond that, it can help to coat the GI tract. And so some things that help coat the GI tract: aloe vera, L-glutamine, licorice, deglycerinized licorice can all help with coating that GI tract. So you might look at some of those things, but I would certainly first recommend, before you did, one of the primary treatments in medicine for H. pylori infection is something called triple therapy, where you take a couple of antibiotics and an anti-acid medication. I personally would look at natural alternatives before going that route, because going that route leads to a overall degradation of the microbiome, and so you're setting yourself up for a potential secondary problem as a result of treating H. pylori with strong doses of antibiotics. So again, you might look at that as an option, as a first option. Okay, another question coming in from D. Rheumatologist said no proof of reflex sympathetic dystrophy is autoimmune. I think you need to fire your rheumatologist. There's lots of evidence that shows that RSD, it's been renamed as well, that RSD is actually an autoimmune process. And in my experience in treating RSD is that it very much is an autoimmune disease. It clinically acts like an autoimmune disease, and it clinically responds just as well as any other form of autoimmune disease. So I would get a different rheumatologist or get a second opinion. The question coming in from Min: once autoimmune antibodies produced, are they to appear in the healing or disappear in the healing process? Yeah. So if you've been tested and you have autoimmune antibodies showing up for a particular tissue, for example, I'll use Hashimoto's. I'll use an antibody called TPO, thyroid peroxidase antibodies. If you're healing those antibody levels, let's say that just maybe originally they were 200, right, which the normal level is under 10. Then what you should see happening if treatment is effective, you should see that number going down over time, and over, again, over a period of about 18 months, you should have complete normalization if you're doing all the right things to put the condition into remission. And that goes to say with any antibody response, if you've had testing done, antibody testing done, where you've had high responses, one of the objective scientific markers to monitor the progress of improvement is to remeasure those at later dates to make sure that the numbers are coming down. But one of the other things, of course, monitoring your progress is how you feel. Because if you, for example, I'm going to use thyroid again because it's so common, but if you have thyroid antibodies and when you first see your doctor, you're sluggish, you're constipated, your eyebrows are falling out, your hair isn't growing, it's falling out, you have complete brain fog, you can't think, you have clouded memory, those things should start improving. And if they're not improving, you're probably not addressing the root reason as to why that condition is there in the first place. So as physicians, we look for two forms of improvement. The most important form of improvement is you feeling better as the patient. The second most important form of improvement is objective lab measurements that show us a fundamental change in your biochemistry that's telling us that the disease process is going away. So both of those are important, but at the end of the day, the most important is whether or not you can function as a human, whether or not you can recover and feel better. So, okay, let's move on. What if the doctor puts you on a daily aspirin as a blood thinner to prevent stroke or CVA? So, Anna, this is a great question. If you've had a stroke or you've had a CVA, then basically, if you've had one of those events, it might be a different conversation. But if he's putting you on them as just a measure because you've got family history and he's just trying to prevent, bad move. There are a lot of things that keep the blood thin, and I would say aspirin is probably one of the worst things that you can use to thin the blood, because that in and of itself, aspirin causes leaky gut and sets the stage for autoimmunity. But the other reason why, and I published this a few weeks ago, and you might go back and look on my Facebook profile, non-steroidal anti-inflammatory drugs are the 18th leading cause of death in the United States. That's aspirin, okay? And aspirin's a non-steroidal anti-inflammatory. And 18th leading cause of death, kills almost 19,000 people a year. And that's normal use, that's properly prescribed. That's not people overdosing, that's not people who are taking it incorrectly. That's people who are taking it correctly. So I don't really recommend aspirin as a blood thinner. Honestly, if your blood is too thick, we have to ask the fundamental question, why is your blood too thick? There's a lot of reasons why the blood viscosity will increase. One of the reasons why it increases has to do with essential fatty acid deficiency. Omega-3s are natural blood thinners, and they keep your blood naturally thin. Vitamin E and selenium and vitamin C and alpha lipoic acid, these are all vitamins and minerals that keep your blood thin. Magnesium keeps your blood thin. So I would default back to measuring a person's nutritional status to discern whether or not they have any nutritional deficiencies that would contribute to a thicker blood before I would recommend using a drug that has a potential toxic side effect to artificially manipulate that person's chemistry to thin their blood artificially. Again, if we can do it naturally, if we can do it through food, if we can do it through supplementation based on a person's problems, it's going to be much more effective in the long run. Okay. So somebody's asking about other supplements. I don't comment on other supplements because honestly, I can't comment because I don't know where it was manufactured. I don't know how it was manufactured. I don't know what the other ingredients in the product are, what the fillers are. I don't know, in some cases they grow them on mediums where they use grain-based cultures. So it's hard for me to comment on that. That's one of the reasons why I started Gluten-Free Society, was because I can put up supplements that I personally manufacture, that I personally have control over, that I know are completely grain-free and don't have any added fillers or things that would potentially harm somebody who needs to be on a grain-free diet. So it's really hard for me to comment about other supplement companies because I don't have that intrinsic knowledge about their back-end processes. Okay. Jennifer, can you reverse migraine damage? Well, if you're asking me if you can reverse migraine headaches, the answer is absolutely, beyond the shadow of a doubt, with 100% certainty, yes. But I don't know if that's the meaning of your question. If you're asking me if you can reverse migraine damage, in other words, is there damage that was done to your brain that potentially caused pathological damage to the nerve tissue itself, and it's been somewhat permanent for you? I don't know if that's your question or if you're just asking whether or not migraines can be reversed. Migraine headache's one of the easiest conditions to treat. I've never met a migraine that didn't go away in 15 years of clinical practice. You just have to find out what the triggers are, and there are a number of different food triggers. There are a number of different nutritional deficiency triggers. Those are probably the two most common reasons why migraine headaches occur. So have a doctor investigate for those potential possibilities. That would be my advice to that question. Okay. I want to pull up another question and just kind of get some experience, get some information and feedback from everyone. How many of you are already following a gluten-free diet? So give me your feedback on that. And I'm gonna add some information. So I talked earlier about gluten and said that the definition of gluten is that it's the family of proteins found within the seeds of grass, meaning that it's not just wheat, barley, and rye. And many of you may not have known that before tonight, or may not have heard that before tonight. And so when I ask the question, how many of you are following a gluten-free diet, what I'm really referring to is how many of you are following a truly gluten-free diet, a true gluten-free diet, or a grain-free diet, not your perception of what a gluten-free diet might have been before tonight. So as you're answering this question, answer it under that condition, that if you're following a true gluten-free diet, answer yes. If you're following a traditional gluten-free diet, meaning only wheat, barley, and rye free, please answer no, because that's really technically not a gluten-free diet. And if you're not sure what gluten is, and nobody's really chimed in on that, and some of you say sometimes. So what I'm seeing back, and the numbers are still coming in. We'll wait for a final answer on that. But it looks like at least 60% of you, 65% of you, are following currently a gluten-free diet, and 19% of you are not, and 16% of you are sometimes following a gluten-free diet. So how do we justify a gluten-free diet? It's probably one of the most important questions you can answer for yourself. Justification of diet change to that degree, because a lot of people who grew up eating grains, who grew up eating cereals and pastas and breads and crackers and baked goods, for them that seems like an impossibility. Like, you're asking somebody to change their diet to that degree, it almost can seem like an impossibility for somebody if they don't have a general justification to do so. Most of my patients have justification to change their diet because they're so sick. They don't want to be sick anymore, and no quantity of diet change is too hard to overcome because they're so tired of being sick. But many people, they don't even know whether or not it's the right thing to do. Some people look at the gluten-free diet as a trend that will come and go, similar to Atkins or South Beach or paleo or any of the other diets that have come and gone over the last 20 years. But the reality is not everybody has to follow the diet per se. Now, the way that you would identify for certain, in other words, if you want to identify for sure, do you need to be on a grain-free diet? Is the grain-free diet the right diet for you? There are a couple of different ways you can go about doing that. One is very subjective, and it's not really definitive, and that is just eliminating it from your diet and seeing if you feel better. Now, the problem with that approach is when you're living in the US, if you're eliminating grain from your diet, you're not just eliminating grain, you're also eliminating mold and mycotoxins, you're eliminating pesticides, you're eliminating bromine as a dough conditioner in many of these bread products. You're eliminating synthetic vitamins. You're eliminating GMO. And so which one of those things made you feel better, right? So many people go grain-free and they feel better, but they think they feel better because they eliminated grains, but it's possible they felt better not because of the grain elimination, but because of all those other factors that go into the grain processing and grain production. So if you really want to know whether grain is truly something you need to keep out of your diet, you know, outside again of a diet elimination, one, I have a quiz that you can take. If you type in gluten sensitivity quiz, gluten-free society, you can pull that quiz up really easy. It's a simple to take quiz. It's a little over 20 questions, and it will give you a not a definitive answer, but it will give you a pretty good idea of whether or not you're gluten sensitive. Now, if you really want to get serious about testing, then what you really want to do is you want to get genetically tested. Now, why is that important? And I'm going to draw you another picture here. Genetic testing. There's a couple of primary genes that we look at as it relates to gluten sensitivity. This is a cell. At the core of the cells is your nucleus and then your DNA, right? And so on chromosome 6, there are these genes called HLA-DQ genes. There's two of them. There's an HLA-DQ alpha 1, and then there's an HLA-DQ beta 1 gene. And each gene is responsible for creating a specialized antenna that sits on the surface of your immune cells. So if we look at this little antenna that's shooting off, the red that I've drawn in is made out of the HLA-DQ beta 1 gene, and the blue portion, this arm, is made from the HLA-DQ alpha 1 gene. So those two genes come together, combined to instruct your body to produce this antenna that sits on the surface of your immune cells. Now, why is it important to understand? That antenna's job is to recognize things in your body that are good versus bad. So it tells your immune system what to attack. And so people who are gluten sensitive will have gluten sensitive gene patterns, so that when they come into exposure or come into contact with gluten, when that receptor comes into contact, the normal response of that connection is inflammation. In other words, so many people think that gluten sensitivity is a disease. Gluten sensitivity is not a disease. It's a state of genetics. You either have the genes that recognize gluten as a foreign enemy and create an inflammatory response, or you don't. And so thereby saying that we can't call gluten sensitivity a disease anymore, we call food allergy a disease. So understanding whether or not you have the genetic markers that confer gluten reaction with exposure, because these genes are going to be activated to create inflammation as a result of exposure to gluten. And so you can silence these genes. If you have them, you can silence them by omitting grain from the diet. So the only way that a person can detect that is with genetic testing. And so genetic, and I've done, probably in the last 15 years, we've done well over 8,000 genetic tests on patients and people. And very, very important to understand that if you're looking for an accurate way, to really test, you can do genetic testing. Now, as part of being on this webinar tonight, if you want to get genetically tested, I'm putting up a big bonus coupon for you to save a bunch of money on this gene test. And this coupon, you can use it. It's expiring at midnight, but you can use it. It's use the promo code DNA. And so all you have to do is follow that link on the side if you're looking to get genetically tested, if it's something that you really want to discern. And again, it's very hard to commit to a diet for the rest of your life if you view that diet as a trend. And so what happens to so many people is they go paleo, or they go Whole30, or they go gluten-free, and they do it for 6 weeks and they feel a little bit better, and then they go back because they never really knew whether it was the right thing for them to do for the rest of their days. In other words, they didn't really know that it was something that they should keep doing, and so they stopped doing it. And so I would encourage you, if you suspect that you're gluten sensitive, but you're not sure, and you're not really ready to commit to the diet because you're not sure, then find out whether or not it's the right thing for you to do. Get genetically tested so that your brain can wrap itself around the idea that if you're committing to this, it's a lifelong commitment. But also understand that because it's genetic, that means it's inheritable, which means if you have the gluten sensitive gene patterns and you inherited them from your parents, and you probably have a strong potential to pass them down to your children. So just that knowledge alone might help you, but also might help your family members find an answer where there are no answers. So that's kind of a breakdown of what I want you to understand about how that works. So I'm going to come back now to some questions I want to ask. Let me load another one here. One of the most common questions I get, and I wanted to address this one as well tonight, is how many of you are on supplements, and what have you found to be the most helpful in your scenario in terms of taking supplements? So if you've taken supplements to help with pain and inflammation or your just general problem, let's just get some feedback from the audience. I think it's important. We'll post the results for everybody. And that way, if you're interested in taking supplements, you'll have an idea of what's worked for everyone else. And I think there's kind of a wisdom and knowledge there for other people who are maybe potentially suffering from the same problem. So it might help better guide you in terms of what you should be picking in terms of supplementation. And we'll leave that up there for a few minutes. And I'm going to take a quick pause because I want to show you guys a story. And so I'm gonna try to highlight some different stories tonight of people who were in chronic autoimmune pain, having chronic problems, and what they did and how they overcame these problems. So we're going to start that now. I'm going to load one of these up. So this is in this particular case is a patient with severe autoimmune nerve damage. And so a lot of people are under the impression that that's uncurable, incurable, unhealable. So you should listen to this really just powerful story. So we'll pause and I'll let you chime in here. Yeah, so just an amazing story, an amazing turnaround, and in that particular case, one of the major things that made all the difference in the world in that particular case was actually vitamin B12 to help reestablish myelin. Myelin is the coating; it's the nerve coating that surrounds the nerves. It's the insulator around the nerves, and so when it comes to neurological disease, a lot of patients with autoimmune neuropathy have an antibody that's attacking their myelin sheath, and to get that myelin sheath to repair, sometimes you can take away the foods, but the problem still persists, and it's because they haven't yet healed, and so the body it needs the ingredients, it needs the proper ingredients to heal, and so one of the things that for neuropathy, one of the main ingredients to help form the myelin sheath is actually vitamin B12, which on that note, I think it's important to talk about another concept is that with vitamin B12 deficiency, it's probably the most common nutritional deficiency that I personally see in my clinic in patients with gluten sensitivity. And if we look at why this can happen, so this is the esophagus, this is the stomach, the cells that line the gut. So imagine those cells going all the way around. These cells, the name of these cells, they're called parietal cells. Now, these types of cells secrete something called intrinsic factor, but they also secrete stomach acid. So it's very important that these cells remain intact so that these two items can be excreted, because what happens with vitamin B12, which by the way is for humans bioavailable vitamin B12 in adequate quantities, is really only found in animal meats. And it's very hard to get enough B12 in a vegetarian diet using algae and mushrooms and other things. But meat attaches to that B12. So as you eat meat, the B12 is attached to it. And one of the things that has to happen is that step one is that this acid has to come in and it has to break the B12 off of the meat. So it's a splitting. It's a splitting process where the B12 is broken away from the meat. So we call that step one. Step two, the intrinsic factor comes in and it attaches to the B12. Okay, so we'll call that step two. And intrinsic factor then carries vitamin B12 down the small intestine where it's absorbed. And this area it's an area of the small intestine. It's a distal small intestine. It's called the ileum. So it's the distal ileum where the vitamin B12 is shuttled by intrinsic factor. It's shuttled into the bloodstream through the ileum. So vitamin B12 has a very, very specific mechanism of absorption. And so one of the problems that happens is gluten can damage these cells. So by the way, so can non-steroidal anti-inflammatory drugs. So if you're on pain medications, you can damage these cells, creating a disruption in your body's ability to secrete acid and intrinsic factor. Now, remember what I said earlier is that acid was one of the 5 primary barriers of the GI tract. So you've got that barrier being potentially disrupted, which is now going to affect the way that you absorb vitamin B12 through this mechanism. But also gluten is somewhat notorious. When we see gluten damage, a lot of times that damage occurs in the ileum. And so it's one of the more common places that we'll see gluten damage is in the ileum. So not only do you get a disruption of potential parietal cell damage, but you also get ileum damage. So both areas where it's crucial for B12 to be able to be absorbed, can become affected. And so the consequence to that long-term gluten exposure is tremendous vitamin B12 deficiency. Now, vitamin B12 deficiency will cause a disruption in your body's ability to produce myelin, and that can lead to neuropathy, among other things. And so this is one of the most important nutrients and one of the most common nutrient deficiencies that I see in patients who have this history of gluten sensitivity. Now, for those of you who have benefited from B12, understand that it's very important that you take the right kind of B12. Methylcobalamin, METHYL cobalamin, is the form of B12 that serves most people best. Hydroxycobalamin is another form of B12 that can be effective, but it also depends on your DNA and on your genetics. But for most people, methylcobalamin is the most effective form, and it's also the most effective when you use methylcobalamin sublingually, meaning that if you swallow it and this process is damaged, good luck absorbing it. If you use it sublingually, it's going to absorb through your cheeks and bypass these broken mechanisms, and you're going to be able to get it into your bloodstream and subsequently into your cells where that it can start going to work. So I'm going to take down this genetic testing. There's only 3 units left, so any of you who are interested, the lab limited us to how many we could give away with that. I think it's a $50 discount using that code. So there's 3 left. If you're interested, grab it now before those go away. But I'm going to go ahead and take this down, and because I want to put something else up. I want to give you guys another. I want to give you guys another opportunity to save some money tonight and on some vitamin B12. So if you're looking for vitamin B12, a valid form of a sublingual B12 in the methylcobalamin form without grains, without corn. A lot of them contain corn as far as the sweeteners. This is one of those that I personally oversee the production of. And the standard dose of this is 1 to 2 lozenges per day to correct the vitamin B12 deficiency. So we've got a nice coupon. If you use the no pain coupon when you check out, you'll save a ton of money. So just putting that up there for you guys, trying to help you out. I'm going to get back to some questions now. Jules asking, are the genes for gluten sensitivity the same for siblings? No, your genes are not your siblings' genes unless you have an identical twin, although they may be similar. So, if you inherited one genetic marker from mom and one genetic marker from dad, then it's possible that your siblings did too, but it's also possible that they inherited a non-gluten genetic marker. So just because you're gluten sensitive doesn't mandate that your siblings are. So we got to keep that in mind as well. Isa, I hope I said that right. Do you recommend a higher fat, 50%, low carb, protein 25% diet? In other words, a 50-25-25 diet. This is highly variable. I actually test my patients. There are a number of different specialized tests that I'm going to order to try to determine the ratio of carbs, fats, and proteins that are going to be optimized for that particular patient. Primarily because I don't like to guess, and I think most people by the time they get into my office have been guessed to death, and we want to be much more definitive in that recommendation. Now, if you're not seeing a doctor and you're just looking for a good place to start, I recommend the rule of thirds: 33% carb, 33% fat, 33% protein, and then you can adjust it from there based on how you feel. But again, that's a lot of guesswork, so I can't really say for certain what's right for you as a unique person. We're all unique in our own right, which is why I do individualized types of tests to get this done. Okay, good question. Another question coming in. Let's see here. Somebody's asking about 23andMe testing. Is that good enough for gluten sensitivity testing? No. 23andMe only measures whether or not you have an HLA-DQ2 or an HLA-DQ8. And so they don't detect HLA-DQ1 and HLA-DQ3, which are the other 2 types of gluten sensitive markers. So there are a lot of people who don't have a 2 or an 8 that are still gluten sensitive. And that's one of the reasons why that test can be very misleading as it relates to gluten sensitivity. It'll only tell you if you have 2 and 8, and those are the 2 genes that have been linked to celiac disease. But again, there's 2, 8, 1, and 3. There's 4 different genotype patterns that need to be investigated thoroughly before you can get a definitive answer. If you just do 23andMe and it comes back negative, it doesn't necessarily mean negative. It could still mean that you're positive. Because you might be DQ1, you might be DQ3, or you might be a combination of the 2. Okay. Next question. I found a great multivitamin from Canada. Yeah, again, I'm not going to comment on multivitamins. I'm not going to comment on other products because I don't have the back end knowledge of how they're being processed. Okay. I'm getting a question. How about milk? I drink a gallon a day. Well, if you're following my no grain, no pain 30-day trial without any testing to see whether or not milk is right for you, you're probably going to feel a lot better. The problem with milk, as it relates to those with gluten sensitivity, is that the vast majority of milk in the grocery store, including butter, including yogurt, including milk byproducts like cheese, is that it's treated with an enzyme. I'm going to draw you kind of another. There's several problems with dairy in general. One, a lot of people with gluten issues, well, you guys didn't see the green, so let me not use that color. Let me use blue. So if we're talking about gluten in dairy, one of the issues is that there's a protein in dairy called casein. Now, if you're drinking the standard milk, even the milk that's organic, the type of cow that's producing that milk is a cow that has been genetically modified or genetically altered, and the casein protein within that milk, even if it is organic, resembles gluten. So that casein can resemble the gluten protein. And so that's one of the problems, is that it resembles gluten. One of the other problems is that many people with long-standing gluten damage, remember gluten can damage the GI tract, and one of the areas it damages is the brush borders. And the brush border is where we make enzymes. Now, these enzymes, some of these enzymes are responsible for being able to allow us to digest lactose. And you've probably heard of lactose intolerance before. There are a lot of people with gluten sensitivity who are lactose intolerant because the gluten has damaged their brush border enzymes and prevented them from being able to properly produce the enzyme that breaks down lactose. That enzyme's name is lactase. That's why you'll see lactate, like the milk that has the lactose removed from it, or it has the enzymes in it. So you've got, this can be an issue. And again, this is not an allergy issue. This is just the destruction that gluten can do to your gut that sets you up for failure to be able to digest dairy. And remember, an intolerance, when you can't digest something, it putrefies in your gut, it rots. And it creates byproducts and fermentation and gas and bloating and pain and irritable bowel syndrome and other kinds of problems. So dairy can be an issue for gluten-sensitive individuals if they've got gluten-induced damage to their brush border, causing a reduction in their ability to properly produce the enzymes to break down the dairy. But there's another, probably the most, in my opinion, the most detrimental piece on why you should avoid dairy, and probably the one that has very rarely been discussed in public. I mean, I spent a lot of time discussing this in my book, is that there's an enzyme used called microbial transglutaminase, or MTG, microbial transglutaminase. This is an enzyme that's used to thicken dairy. It's used to extend the shelf life. So it's commonly used to process dairy products, including organic dairy products, including dairy products that are healthier than some of the others, like the standard milks that might contain recombinant bovine growth hormone and some of the other negative or detrimental products or chemicals. When you add MTG to dairy, it makes the casein in the dairy resemble gluten. So the act of processing dairy with MTG kind of draws back and feeds right back into number one. So, you know, my advice to anybody who's suffering with chronic autoimmunity is, if they're gluten sensitive, that we have to absolutely get the dairy out of the diet for these multitudes of reasons. And beyond that, dairy is highly mucogenic, meaning it stimulates excessive mucus production. So if we've already got somebody who's chronically dealing with chronic sinus congestion and potential mold allergies and mold formation in the sinuses, dairy can be the thing that allows that to continue to be prosperous and make it harder to treat. So there are a number of reasons why I would say avoid dairy, but those are probably the big three that you want to be concerned with. So check that out and see if that doesn't help you. It's a great question. I think probably a question that doesn't get answered for a lot of people in a traditional doctor's office. Okay. I want to pop up another story. I want to share another story with you. So we've addressed nerve damage tonight, and let's talk now a little bit about muscle damage, joint damage, and eczema. This is a story of another patient who made a huge dramatic recovery, and it's probably one of the most powerful testimonial stories of a patient of mine that we've ever shared. So here we go. We're going to load that up. Okay, yeah, another extremely powerful story, major recovery. So I want to go back to what we were talking about beforehand. We kind of got off topic and we started to talk a little bit about dairy. We were talking about vitamin B12. Again, I'm going to keep that B12 offer up there. There's a few bottles left with that big discount, but I want to go back to our poll and you know, as far as what has been helpful for those of you who took and participated in the poll. You know, we've got 20% of you telling or saying that probiotics were the most helpful. We've got 11% of you saying that vitamin D, and 16% turmeric, and 22% magnesium. So if we put that in order, it's magnesium wins, probiotics number 2, turmeric is number 3, and vitamin D is number 4. And then subsequent to that, we've got vitamin B12 and proteolytic enzymes, and fish oil coming in at number 5, 6, and 7, all really kind of tied for that. So I will comment on that. One of the issues that we'll see with magnesium in terms of pain reduction is magnesium is a natural muscle relaxer and it's a blood thinner. And so a lot of people with spasms, chronic spasms, we're going to get an improvement in muscular pain as a result of just relaxing that muscle a little bit better. And many people use magnesium oil. Many people are going to use magnesium Epsom salt baths. Now, those are okay as well. Now, but a good dose, a good starting point or a good starting dose of magnesium is about 500 to 600 milligrams. You can go up from there. You can go down from there. If you're getting too much in, it'll actually cause you to have loose bowels and diarrhea. So you have to, be careful of that as well. There are a number of different forms of magnesium. There's citrate, and there's malate, and there's glycinate, and there's gluconate. There's also a form that you should never, ever, ever buy, and that is magnesium oxide. So if you see magnesium oxide, OXIDE oxide on the bottle, then just go ahead and put it down. You're not going to absorb much of that. It's not going to work very well for you. So just not a great form of magnesium. If you're doing a liquid magnesium, probably one of the most effective liquid magnesiums is hydrochloride, magnesium hydrochloride. So now when it comes to probiotics, one of the things that you have to be really, really careful of is you have to be super careful that the probiotic was not grown on a grain-based culture. And not all probiotics are done that way, but many of them are. Many of them are grown on corn or other forms of grain-based culture. And a lot of these cultures are also genetically modified grain cultures. So you have to take that piece into consideration. Avoid any kind of grain-based probiotic. I've seen patients react quite severely to these forms, and if you're actually gluten sensitive, it can really create a problem for you. Okay, let me just check something here. One of the other kind of winners of the supplement reducing pain was turmeric. And turmeric, if you're buying turmeric, couple of important points. One, you can use turmeric as a spice. It's very effective, and a lot of people will mix it with lemon juice and drink it that way, or make teas with it, and that's fine too. You can use it that way. You can use it to make curries. So there's a number of food applications for turmeric. If you're going to take it supplementally, you really need to strive for 1.5 to 2 grams of turmeric a day for it to be effective. Otherwise, it's kind of like trying to spit on a forest fire. It's not going to be all that effective in its dose. Some things to look for in turmeric. One is that if you're buying a supplement, that it needs to be concentrated and it needs to be standardized. And when I say standard, I mean the active anti-inflammatory ingredient in turmeric is called a curcuminoid. And so if the product isn't standardized to contain 90–95% curcuminoid, then it's probably not going to be super effective or concentrated enough to have a really potent anti-inflammatory effect. So that's one of the aspects that you're looking for. And one of the other that you want to look for is one of the other ingredients that you can put with turmeric is something called bioperine, which is black pepper, and that actually increases the absorption and the effectiveness of turmeric. So by adding that, you can get a synergistic effect. I'm putting up again, I've got a form of grain-free turmeric that I carry and process and manufacture directly. And you can check that out, and if you want to pick it up, there's a no pain promo code that you can use tonight as well, and I'll leave that up for a little bit for you to take advantage of. Okay. We're going to ask another question. I want to get a little bit more feedback from you guys. So this question, let's find out how many medications are you currently on. So those of you chime in. Hopefully that none value is going to be the highest, but I know with chronic pain and people with chronic pain, it's very common to be on multitudes of medications and trying to combat that pain. So just kind of get a feel for the audience, because one of the other topics that I want to discuss with you this evening on the webinar is the topic of drug-induced nutritional deficiencies. And it's a very important concept, and every drug, no matter the drug, has what's called a risk-benefit ratio. And that risk-benefit ratio is how much risk of side effect that drug will cause versus how much benefit that drug will provide the person taking it. And so what I see based on preliminary poll results coming in right now is that half of you listening in tonight are on medications. 19, almost 20% of you are on at least one, almost 15% on two, 7% on three, 4% on four, and up to 8% of you are actually on 5 or more medications. Now, drug-induced nutritional deficiencies, very important to understand, and I'm going to kind of talk about some of the main issues of some of the more common medications that we'll see people taking. So one are antacids. Antacids. Another one is non-steroidal anti-inflammatories, or NSAIDs, non-steroidal anti-inflammatory drugs. Now, another common one is antibiotic. Many people are taking thyroid medication, like Synthroid. Many of you might be taking other forms of medications for depression, so antidepressants. Okay, so we'll look at these classes of medications and just giving you guys some information. Again, these are important to understand because if you're on any kind of medication to treat or help manage your condition, and you're not addressing the nutritional aspect of deficiencies that come along with that drug, then what ends up happening, you can get stuck in a vicious cycle of drug-induced nutritional deficits leading to subsequent problems that it just becomes very, very muddled clinically. And then the doctor says, oh, you're having this side effect from that drug? Well, let's add this new drug to cover that side effect. And then you develop 3 more side effects. And in the process, you develop 10, 15, 20 different micronutrient deficiencies. So we look at antacids. Protein deficiency can occur, calcium, magnesium, iron, vitamin B12, vitamin B2, vitamin A, zinc, selenium are some of the more common deficiencies that we're going to see in people who are taking antacids for any long distance time frame. So the problem here is that, you know, these are based on this is based on studies in clinical. Not everybody on antacids always has a calcium deficiency. Not everybody always has a vitamin A or always has a zinc deficiency. So if your doctor's got you on a litany of medications, in my opinion, it's his ethical obligation as a physician to monitor that drug-induced nutritional deficiency piece, because if he's not monitoring it, he's just leaving you wide open for a problem. Now, let me give you just an example here. Antacid deficiency or antacid use can cause a vitamin A deficiency. Vitamin A deficiency causes leaky gut because vitamin A is necessary for the cell lining in your gut to recover. So your gut cells, they recover, they grow, they replicate. Every 2 to 7 days, that lining is brand new. And vitamin A is a big part of why that happens. And so if you're not regenerating and renewing that gastrointestinal lining, you're going to get holes, you're going to get breaches in the barrier. So being on this medication to treat one form of GI problem can induce another deficiency that can create a different form of GI problem and then subsequently contribute to an autoimmune process. Again, that's just one example of what we're talking about here. Now, non-steroidal anti-inflammatories, this particular class of medication, oftentimes we're going to see vitamin C, we're going to also see folate, and we're going to see iron deficiencies. Also, for some people, pain medications can cause glutathione loss. So if we're talking about a drug to treat pain, here's the big kicker. You're treating pain, and when you're treating pain, you're blocking these 2 nutrients, folate and vitamin C. Folate and vitamin C are prerequisites for you to be able to produce new cartilage. And part of the pain that you're treating, if it's joint pain, is cartilage degradation, osteoarthritis, or inflammation to the cartilage. So how do you repair that cartilage if you're blocking 2 of the main nutrients that are necessary for cartilage replication and healing? So again, you get stuck in this vicious cycle. If we look at antibiotics cause vitamin K, and biotin deficiency, and other B vitamins as well. As a general rule, B vitamins can be impacted greatly by chronic antibiotic use. So it's not the person who takes an antibiotic one time in their life. What I'm really referring to is that person who's back and forth the doctor. They're getting put on antibiotic after antibiotic. They get sinus infection after sinus infection. Before you know it, you've ended up with these types of problems. Now, vitamin K deficiency causes contributes to cancer and bone loss. Vitamin K is necessary to clot blood properly. So there are a number of different functions for vitamin K that, if you start blocking it, you're going to start developing those side effects. Biotin is oftentimes referred to as the skin, hair, and nail vitamin. It's also known as vitamin B8. And what biotin is important for is not only skin, hair, and nails, but also the metabolism of fat. So it's how your body breaks down and builds new forms of fat, which is a very, very critical, very crucial function. All of your steroid hormones are made out of fat. So if you're low in biotin, you're going to actually have problems with the production of different types of hormones. And so you actually start to develop hormone dysfunction as a result of antibiotic use, long-term biotin suppression and deficiency. Thyroid medications. Thyroid medications can contribute to B12 deficiency, but depending on which thyroid medication that you're on, the most commonly prescribed thyroid medication is thyroxine. And so thyroxine has corn in it. And so now we got corn as a grain, as a gluten, contributing to leaky gut. And remember that depending on the kind of thyroid disease that you might have been diagnosed with, if it's an autoimmune thyroid disease, autoimmune disease begins with leaky gut. And if we're taking a drug to compensate for the thyroid that's creating a problem with leaky gut, then we end up with a perpetual drug-induced cycling of that disease. And so again, it becomes virtually impossible to get a person better. I've seen a number of cases of women in my office with, they feel so much better, but they just can't get past the fatigue. They just can't get past the hair loss. And one of the reasons why is the thyroxine that they've been put on is full of corn. And there's a very easy solution to this. Ask your doctor to compound it for you. Ask your doctor to give you the same drug, only have your compounding pharmacy create a compounded version without the corn. And then you got the depressants, the antidepressants. These drugs will impact and affect CoQ10. And you guys still see that? Yeah, you still see that. They'll impact folate. And what's ironic about that is that when you take a drug that blocks folate to treat depression, know that folate deficiency actually is one of the major causes of depression. You need folate in order to properly metabolize serotonin and dopamine, which are kind of happy, feel-good hormones that you produce. So again, this whole concept of drug-induced nutritional deficiencies, I mean, more than half of you at this point, the poll indicates that 53% of you listening tonight are on some form of medication. And so you want to take that part very seriously into heart. And, again, if you've got a good doctor, a good capable doctor, have that conversation with them. Don't sit by idly and hope that the problems don't come. Now, drug-induced nutritional problems are very, very real. There's 2 medical texts that have been written on the topic. I've written extensively and published extensively on the topic as well. And it's something that you want to be aware of if you're needing a medication or if you're taking a medication. Okay. Let's go back and let's answer a few more questions. I'm getting a question from Debbie. My functional doc does muscle testing. Is that a good way to test? No. Not that it's horrible, not that some people don't get benefit. Muscle testing to test for vitamin mineral deficiencies, muscle testing to test for food allergies and things of that nature. It's very subjective. And I say that not to say that there aren't people that don't receive a benefit from having muscle testing done on them, but let's just use this scenario. You go in to see your doctor, he muscle tests you, and let's say that your doctor worked out that morning and he worked his shoulders out, so he's really kind of gassed and tired, and so now he's using that tired shoulder to muscle test you. That's what we call in science a variable, right? It's a variable we're not controlling for. Let's say that let's take that same scenario and say, instead of saying that your doctor worked out that day, let's say that somebody in the waiting room is wearing an offensive perfume, and that your doctor's muscle testing you to try to see if you're reacting to something in particular, and you're smelling that perfume, and he's having you hold something like maybe he's having you hold a vial of wheat or a vial of something to see whether or not you're allergic to it, but you're actually smelling that perfume and you're testing weak because of the perfume and not the vial you're holding. But he's making the claim, or she's making the claim, that you're testing weak because of the vial that you're holding. And that, again, is what we call a variable. It's very hard to control those variables. And, you know, so I don't really recommend muscle testing as a long-term viable way to discern the origin or underlying reason why you're having the problem. Some doctors will use it not as their main tool, but as a kind of occasional tool to use as a diagnostic. But honestly, you've got to use, in my opinion, you've got to use scientifically validated, objective, repeatable, verifiable lab data that's based on you as a unique person, you as a unique individual. These types of tests, we kind of coin them as functional outcome tests. In other words, there's two kinds of lab tests. There's the standard lab test that your doctor orders that measures for, you know, a range, right? So like if you went into the doctor and you had your liver enzymes or your cholesterol measured, they would tell you it's high or low or normal based on this set range. And so then the next question then becomes, what is the range derived from? In other words, where did that range come from? And a lot of people don't realize this, but that range actually comes from, and it changes regularly. The range changes based on the region in the lab, but it changes based on, those ranges are generally taken from a sample of the population, you know, about 10,000 samples. And so we take those samples and we average them. But before we average them and create a range, we throw away the top 2.5% and the bottom 2.5%. So we throw away 5% of the data, and then we calculate the average of all the data, and we draw a bell curve around it. And anybody who falls within 80% of the mean of the middle is considered to be normal, and that's where that comes from. So if you have a understand this too, that of those 10,000 people, some of them are men, some of them are women, some of them are 200 pounds, some of them are 100 pounds. So there's a lot of variability from one unique individual to the next individual, which is why a lot of times those lab tests will come back normal, and your doctor will look at you like you're crazy, scratch his head and say there's nothing wrong with you, you're in perfect health, and sends you to a psychiatrist. And this is where functional medicine comes in. This is where functional diagnostics come in, because when we're doing lab tests, we really want to have a validated, objective means of measuring certain parameters, but we want to have, it needs to be validated in such a way we're not comparing you to other people, we're comparing you to you, or we're using you as your own control. And it's very important from a technology perspective that that's the kind of lab that you seek out if you want to have real definitive answers. Okay, hopefully that steers you in the right direction. Okay. Somebody's asking about how to deal with eczema. It looks like Donald. Eczema, you know, an autoimmune skin condition is pretty easy to deal with. Most commonly, grain plays a factor. Grain plays a contributing factor in generating the autoimmune process. A lot of these people have liver damage, and that's one of the reasons why the eczema is showing up, because the skin takes on the job of the liver when the liver can't do its job. But a lot of times we'll see zinc and essential fatty acid deficiency and vitamin C deficiency. So again, I'm going to test somebody to discern which ones of those types of deficiencies that we need to target supplement for in order to get a full recovery. Now, one of the freest and easiest things you can do to help treat eczema is to get sunshine. Vitamin D is one of the most potent, and ultraviolet light both of those things are some of the most potent tools in helping to deal with autoimmune disease in the skin. So if you've got that, I would certainly recommend it at a very bare minimum, 20 minutes of exposure to sun every day, and that's without sunscreen. And then you know, have your diet analyzed and have your nutritional status analyzed. I mean, that's kind of the 67 elevator pitch for how to deal with eczema. It's a great question. Kathy's asking about low adrenal levels. I was on hydrocortisol. But now I'm off, only doing DHEA. Is this connected to gluten issues? Yes, it can be. It's not that all adrenal dysfunction disorders are caused by gluten, but certainly gluten can contribute to adrenal dysfunction. So, you know, again, it boils back down to proper diagnostics, proper investigation. Some people with adrenal burnout have horrible lifestyles, and they're under too much stress. They hate their job. They're at odds with their spouse. They have children that stress them out to large and varying degrees. And so their adrenals are on overdrive. They don't sleep enough. They don't get enough sunshine. They don't eat a good diet. They drink too much coffee and overstimulate their adrenal glands. So there's so many factors involved with adrenal burnout But yes, to answer your question, gluten does and can contribute to adrenal dysfunction and adrenal disease. And one of the main mechanisms behind that actually has to do with vitamin C and vitamin B5. Vitamin C deficiency vitamin C is necessary for your adrenal glands to properly function, and gluten sensitivity can contribute to malabsorption syndromes. And one of the biggest and most common nutritional deficiencies is vitamin C. Now, the other big ingredient that your adrenal glands need to function properly to produce adrenal hormones on their own is vitamin B5. So you take vitamin B5 and vitamin C and you mix them together, and you have a great adrenal support formula for somebody who's got chronic adrenal dysfunction and malnutrition as it relates to gluten exposure. So, hopefully that's helpful for you. Okay. Okay. So a lot of these topics that I'm talking about tonight, I'm talking about there. A lot of them are concepts out of the new book, No Grain, No Pain. If you haven't gotten your copy, I highly encourage you to do so. Not only will you be helping yourself out, but you'll be helping me out. We've pushed up the rankings pretty quickly on this thing, and we're actually pushed into the bestseller position. But if we can push harder and sell more copies of this thing, what Amazon does is, as that happens, is they show the book to more people, and it just basically it puts the book into more people's hands and helps more people get the help that they need. My clinic is booked out in advance. We book out several months in advance, so there's no way I can possibly treat the quantity of people who need the kind of help that I offer. So, again, that book helps get the right type of information into your hands and into other people's hands who maybe are waiting to get in to see me in the clinic, but are also maybe just looking for help without actually going to see a doctor. Now, any of you who pick up your copy tonight, if you haven't already picked it up, we're also giving away. I have a special bonus gift for anybody who buys the copy. It's my leaky gut recovery manual. It's over 50 pages of information about how to recover and repair a leaky gut, including supplement protocols. It also comes with a video that's about 2 hours long. So it's just a bonus to say thank you for helping me reach more people. Thank you for supporting my mission of No Grain, No Pain. So if you want to get a copy of that, I'll leave that link up for you, and you can grab it. Okay, I want to show you another story. A lot of people ask me about weight loss, and I'm not a big fan of weight loss diets because I believe that true health leads to healthy weight. And as opposed to trying to achieve health through weight loss, I'd rather somebody achieve weight loss by getting healthy. But I want to share a story with you of somebody who was so distraught and their outcome and their outlook was so bleak. They didn't think that it was possible, even at her age, that she could make a comeback. And so I want to share her story with you. And so we'll just take a couple minutes to watch her story as well. Okay, so back again, just more powerful stories, people that even against the odds, were able to make a comeback and make a big change and improve their life. I want to take the last. We got about 10 minutes to go tonight, and what I want to do is I want to take the try to get a couple more questions for folks answered. Um, okay, let's see here. Can LPS antibody? Well, let's see. No, that. Can LPS antibody test diagnose leaky gut? No, not really. The theory is that if you have an LPS is a lipopolysaccharide, and so if you've got antibodies in your blood to lipopolysaccharides, and technically they're leaking from your gut into your blood where the antibody is then found. Um, Not definitively. I mean, it's a clue or an insight into leaky gut, but it's definitely not a definitive test because you can have bacteria in your bloodstream that didn't come from your GI tract that also have the capacity to produce LPS. So, I mean, bacteria can in fact can get into your joints. Bacteria can get into your organs and can create infections in those areas and spin out LPSs. So just LPS in and of itself, antibodies in the blood, is not a direct indicator for leaky gut. It's an indirect clue that you might have leaky gut. Hopefully that's helpful as an answer for you. Somebody asked me, I think this is a really pertinent question. Some of these lab tests are expensive. And some people don't have the budgetary constraint to move forward on certain types of lab tests. And so, what is the easy version? What is an easy way to try to restore and improve your health without going through the lab process? And the simple answer to that question is no grain, no pain. Of all the books that get written, a lot of people write books, and there's a lot of great information that are out there. There's a lot of great doctors, a lot of really smart people. I can just tell you that no grain, no pain comes from the heart, and it comes from a place of clinical experience. In other words, it's not a book about theory and posture. It's a book about actual science combined with clinical experience and dealing with over 5,000 patients over a 15-year career. So I think it's a really, really great place to start. To start if you can't afford to do some of the lab testing, can't afford to do some of the more objective, scientific, individualized tests. Okay. Somebody's asking about any plans to make an audio version. We actually have an audio version. You can buy the CD MP3. We just did a deal with a company named Tantor, and I think they've already got it up on Amazon. So that's available now. There's not an Audible version if you use Audible on your iPhone as an app, but from what I understand from our publisher, it's in the works. So if you like Audible, you can hold off, or if you just want to get the MP3 download, I think that's already available online. Okay. So another question: any recommendations for low bone density test results? Yeah, low bone density. First of all, understand that bone density testing is not the end all be all. In other words, your bone density test is not an indicator for how healthy your bone is. I know it comes as a big shock. Bone density testing, all it is measuring, it's a measuring an expression of how well your bone absorbs X-rays. That's it. That's why they call it a DEXA scan, dual energy X-ray absorptiometry. So that knowing how many X-rays your bone can absorb doesn't validate how healthy your bone is. It validates how dense it is, but bone density is not the only marker for bone health. So if you've got a low bone density test result, I highly recommend getting with your doc. There's a couple of tests that you can have done. One is called osteocalcin, and the other is called deoxypyridinoline. And these types of tests will show you how fast your bone is breaking down versus how fast it's building. And it's a much more valid marker, and you can run this type of test every several months, whereas a bone density can only really be done with any great accuracy about every 2 years. And if you have these are urine tests, again, osteocalcin and deoxypyridinoline, these two types of tests measure bone breakdown versus bone building. And if you're breaking down bone faster than you're building it, and you're trying to use supplementation and exercise and lifestyle changes to improve your bone density, this test allows you to monitor the progress and the improvement that you're making sooner than every 2 years. Because if you wait 2 years and you're doing all the wrong things or you're not doing enough of the right things, you've lost 2 years of potential bone building, and that's not good either. So it's best to run those markers about every 3 to 4 months. And as far as bone nutrition is concerned, there are a lot of things that can be done. Bone broth is a great way to get some of the nutrients necessary to help you build strong, healthy bone. Exercise, weight-bearing activity, and I'm not talking about walking. I'm not talking about light activity. I'm talking about physical weight-bearing activity with weight. Is a great way to build, and whole body vibration platforms are great ways to help build and increase bone density. You can check those out, check the information out on my website. I have some information about whole body vibration platforms. If you type that in with my name in a Google search, you'll find some pages that might guide you in the right direction. And then in addition to that, checking your nutritional status, because most doctors will just tell you, oh, your bone is low, here's calcium. That's never going to work, because bone loss is not caused by calcium deficiency alone. Most people with bone loss don't even have calcium deficiency. We've measured, I've probably done more nutritional evaluations of people's blood than most doctors in the world, and that we have not seen a great correlation between osteoporosis and low calcium. More specifically, we've seen that correlation with low vitamin K and low vitamin D and zinc and copper and vitamin C and magnesium and boron and vanadium. So there are plenty of other nutrients that are low that can cause loss of bone, but probably one of the most overlooked reasons why bone loss occurs in the first place has to do with, as it relates to grain, has to do with gluten sensitivity. Osteoporosis was identified as an autoimmune disease, and there was a nice article published in the New England Journal of Medicine several years ago where they found bone antibodies in patients with osteoporosis. So we're now looking at osteoporosis more as if it's an autoimmune disease and it's actually a nutritional deficiency. And so again, with autoimmune diseases, we started this conversation off tonight with 4 common contributors and causes of autoimmunity. And so you got to go back to that fundamental starting point, and you've got to start looking at those things first. So hopefully that's helpful for you. Okay. Sarah's asking, do pseudo grains contain harmful compounds similar to gluten, or contain gluten proteins? The answer is yes and no. Pseudograins technically aren't grain, and that's amaranth, buckwheat, and quinoa. So for those of you who want to know what a pseudograin is amaranth, buckwheat, and quinoa. There's some studies on quinoa showing that some of the proteins in quinoa resemble gluten proteins enough to cause damage. So I highly encourage people to stay away from quinoa. Amaranth and buckwheat, 41% of them are cross-contaminated with enough gluten to create damage. And so that's the yes and no, is that, the cross-contamination of pseudograins is quite high. So the possibility that you're going to get cross-contamination is there. So these are just food products I don't recommend people with grain issues take on as substitutes, especially not in the initial stages of trying to heal, when we're really trying to put an autoimmune disease to bed. We don't want to potentially introduce things that either are cross-contaminated or have the potential to react with our bodies in a way that's so similar that it creates the same outcome. So Jan is chiming in. Question is, so one does not have to have celiac to have a malabsorption issue? Absolutely not. Celiac can cause malabsorption, but so can a lot of other conditions. So parasite infection can cause malabsorption, intestinal infection, an irritable bowel syndrome with diarrhea as its primary constituent symptom can cause malabsorption. Not having a gallbladder can cause malabsorption. So, I mean, there are a number of different aspects or issues that it can create malabsorption that are above and beyond celiac disease. So hopefully, again, that answers your question. Is there a T4 other than compounded that is gluten-free? Compounded is very expensive. Tyrosine, but no, in order to get a good T4, to my knowledge, no, you really have to get it compounded. My follow-up question to that is, why would you need T4? I mean, a lot of people go on thyroxine under the auspice that their thyroid is broken, but their doctor never tells them why their thyroid is broken. I mean, thyroids don't just break down because. There's usually an underlying reason as to why it's not working. And understand that T4 itself, we'll draw one more picture. Our brain makes this hormone called thyroid stimulating hormone, TSH. And most doctors that are measuring or monitoring thyroid will measure TSH. But TSH stimulates the production of T4. T4 is produced by our thyroid glands. And then T4 has to be converted into T3. T4 can also be converted into something called reverse T3. The 4 in the T4 represents iodine. The T in the T4 represents protein, particularly the amino acid tyrosine. So, there's two kinds, primarily there's two kinds of hypothyroidism for most people that don't have severe brain dysfunction or tumors. One of them is called autoimmune thyroid, otherwise known as Hashimoto's. And I'm talking about low thyroid, not hyperthyroid. I'm talking about low hypothyroid. And the other is nutritional hypothyroidism. And most of the people that I see have a dual. They have Hashimoto's, but they also have a nutritional hypothyroidism. So there's kind of the duality that's going on. And so they're on a T4. And what's happening is they would make their own T4 if they were getting enough tyrosine and if they were getting enough iodine. Now, two other nutrients that help put tyrosine and iodine together, vitamin B2 and vitamin C. So if you have vitamin B2 and vitamin C deficiency, you won't properly make your own T4. If you have an iodine deficiency, you won't make T4. If you have a tyrosine deficiency, you won't make T4. There's a couple of other things that can affect and impact this. Bromine, chlorine, and fluoride. These three, oftentimes referred to as halides, they will compete with iodine to get into your thyroid gland. And so if you have an overabundance of these three in your environment, sometimes you can have a chemical-induced hypothyroidism. So again, I go back to the root cause. I mean, I really don't care about long-term medication use, because typically if we treat the origins and we treat the reasons of why the disease is there in the first place, and the medicines become unnecessary, and then you don't have to worry about the expense of compounding. You've taken care of the origin of the problem, and you can move on with your life, and you can quit worrying about medical bills and drug expenses. Okay, and I have a nice video on thyroid function that you can, if you go to Gluten-Free Society and just type in Gluten-Free Society and hypothyroid, you can pull up a really nice and detailed video, and walk through that video, watch it several times, because I think if you pick up on that, you'll learn a lot from it, and hopefully you'll be able to take that back to your doc and get some meaningful solutions to your problem. Okay, let's do one more, and then we're going to look to kind of start shutting down here. Simple question, Veronica, going grain-free, how long should it take for the pain to subside? Veronica, that's a varying question, depends on the person, depends on whether or not you're getting cross-contamination or exposure from other sources, depends on whether or not you have other underlying issues that haven't been investigated or haven't been addressed. For example, you could be grain-free and you might not be responding because you also have an omega-3 fatty acid deficiency. And omega-3 fatty acids regulate how your body deals with inflammation. So if the grain was causing the inflammation, right? In other words, the grain is what led to the inflammation. The inflammation is there. You take the grain away, the inflammation doesn't just necessarily disappear for everybody. Sometimes you've got to have the right tools internally. Your body's got to have the right tools to put the fire out. And so if you're deficient in some of those tools, if you're deficient in omega-3 fatty acids or antioxidants, then you may have taken away the thing that caused the fire, but the fire still has fuel, and the fire is still breathing, and the fire is still a living entity. And so in order to fully put it out, you have to address those underlying issues. But for most people, I know I'm skirting around your answer, your question. Now, for most people, we're going to see dramatic improvements within 4 to 8 weeks as it relates to pain, and that's joint pain and muscular pain. We're going to see dramatic improvement. But sometimes we see plateauing of that improvement or minimal improvement if we don't address those other underlying issues. So keep that in mind as you're moving forward. Great question from Karen. Help, I just started your no grain diet and have monster cravings. How long does this last? 7 to 14 days. For most people, 1 to 2 weeks. Get a good support system around you. Get friends and family that can hold you accountable. Get the grain out of your house. Don't go out to eat. Those are the best things you can do for the first 7 to 14 days to prevent your, because a lot of people break down and they have a weakness. And, you know, if you can get through that first 7 to 14 days, you're going to do fantastic and come out on the other side. Okay. How do you detox from mycotoxins and heavy metals? Boy, that's a big, big question. First, you check to make sure you have them. You don't do a detox if you don't have the problem, because a detox is a tax on the body, and we don't want to tax the body unnecessarily. So, first of all, let's talk about how to test for heavy metals. One of the best ways to measure heavy metal toxicity is doing what's called a pre and post urine provocation test, and that's where you take a chelating agent and collect urine, and you measure the output of lead and mercury and cadmium and arsenic and several other types of heavy metals. So first is the detection, proper identification and detection of whether or not it's even an issue. With mycotoxins, there's several categories of mycotoxins. And again, before you embark upon any kind of detox, you want to look to see if they're there. And so the best way to look at mycotoxins to date, and this may change as technology changes, but the best way to look at them currently is using urinary mycotoxin output testing. As far as detoxification is concerned, there are a number of different things that can be done. Some people can use activated charcoal. Some people use algae. Blue-green algae is a great detoxifier. Chlorophyll is a great detoxifier. N-acetylcysteine, lipoic acid. So there are a number of great things that will help ramp up your body's detoxification systems from a supplemental perspective, but nothing beats sunshine and sweat. When it comes to detoxification, I have not seen anything clinically match sunshine and sweat. So if you're exercise intolerant, as many people with chronic autoimmune pain are, they can't exercise enough to create or generate enough sweat to be effective. One of the best ways to increase or work up the sweat is a magnesium bath, hot water, magnesium salt bath. One of the other ways, and that's probably the cheapest way, the other way is infrared. Now, many people with chronic autoimmune disease don't do well with infrared. There's two kinds of infrared. There's near infrared and there's far infrared. And most of your far infrared units have a lot of EMF output. So some people with autoimmune disease are really sensitive to EMF, electromagnetic frequencies. So far infrared can work much, much better for those really highly sensitive people to work up and help induce a sweat on a very, very, very consistent basis. Now, one other tool to use for detoxification that is free, doesn't require any money, and is very, very effective is controlled deep breathing. One of the primary mechanisms your body uses to detox is breathing. We actually emit toxins through our breath. So if you are very shallow of your breath and you're very short breath and your life is very hectic and very fast paced, generally you're not breathing deep enough, and part of that is you're not detoxing through that mechanism. So intentional breathing is very, very important. Not only does it help detoxify, but it helps slow you down, it helps calm the mind, it helps calm the body and reset the nervous system to start responding appropriately. So a great way to start deep breathing exercises is I like to have people do it right before they eat, because it gets their guts ready and primes their guts for digestion. So it will improve digestion and absorption of nutrients, but spend 2 to 3 minutes before a meal in a nice, calm, relaxing environment, just controlling your breathing. So deep belly breaths, in and out, nice and calm, nice and relaxed, no TV, no stress, no screaming children, no arguments, no news radio. And just relax before you eat with some deep controlled breathing. And the more you practice it, the better you get at it, the more you're going to want to do it and add it consistently to your repertoire. But it's a great way to add, it's a great tool, it's a great free tool to use to help you detox beyond using, because so many people, so many patients will react negatively to a lot of the different detoxification programs, the pills and the other things and the supplements that are out there. So sometimes a natural detox is the best way to do it. Okay, I'm going to answer. I know I keep saying this, but I'm going to answer another question anyway. What about hormones and PCOS? So question coming in from Lisa. Hormones and PCOS. PCOS is polycystic ovarian syndrome. Basically, this is a condition. Basically PCOS is diabetes. It's diabetes of the ovaries in a nutshell. You know, there's diabetes of the brain, oftentimes referred to as type 3 diabetes or Alzheimer's disease. There's diabetes of the pancreas, oftentimes referred to as adult onset type 2 diabetes. But what we sometimes call female diabetes is PCOS. So, you know, can gluten impact PCOS? Absolutely. Gluten causes a hormone disruption. I talk about the cortisol and insulin connection and what gluten does to trigger that response and contribute to dysregulation of blood sugar, leading to all different kinds of diseases associated, including PCOS. And I talk heavily about that in the book. But also PCOS, again, it's an issue of needing to have better control over three fundamental pieces. One, diet. And the most effective diet for a diabetic and for somebody with PCOS, if I'm generalizing and I'm not doing specific testing, is dairy, grain, and sugar-free, and low carb. No more than 25 grams of carbs at a sitting. Low carb, because we got to get that insulin back under control, and sometimes inducing a little bit of ketogenesis can help do that much more quickly. So that's diet. So one of the other things that's very, very effective is sunshine, because vitamin D all by itself, the deficiency of vitamin D can cause diabetes. And vitamin D is technically not even a vitamin, it's a prohormone. So it's a misnomer. And so many people don't get enough sunshine, and they end up suffering the blood sugar complications of vitamin D deficiency. And as we saw in the poll earlier, I think it was 11% of you felt better going and using vitamin D as a supplement. So those poll results speak to part of that as well. And then the third piece is exercise. You've got to introduce high-intensity interval training exercise where you're building and growing muscle tissue, because nothing regulates blood sugar better than having muscle. And when I say having muscle, that doesn't mean whole killer muscle. You don't have to become a bodybuilder to have a high-quality lean body mass, but you have to use high-intensity weight-bearing activity to build it. And sometimes, that can take 6, 12, 18 months, depending on the person, depending on your consistency of exercise, and depending on your ability to tolerate the exercise. So a lot of issues there that would impact potentially PCOS. Lynn's asking, if you have been hypothyroid for 30 years, can you still fix it? Yes. I'm going to answer that question with excuse me, my throat's drying out on me. I'm going to answer that question with a concept. If you cut your skin and you've gotten a cut before, and you're older than 30 years old, will your skin heal if you get a cut? And the answer is yes. Well, I mean, if your thyroid is broken, can it heal even though it's been broken 30 years? Yes, if you figure out why it's broken. Again, the critical message there, just like what we were talking about on the board behind me. Amanda's asking what mycotoxins are. Mycotoxins, in a nutshell, are mold poop. It's a byproduct of mold. In other words, it's a chemical toxin that molds can produce that can be highly, highly toxic to humans. And so some people are allergic to mold, and some people are allergic to the toxins that mold produce, and some people are allergic to both, and some people are just allergic to just the mycotoxin itself. So mycotoxin is basically a byproduct toxic compound that mold can produce. Okay, Crystal's asking if she has an appointment scheduled with me, should she order the DNA test now or when she sees me? Well, Crystal, if you order it now, you'll save money. I can tell you that. So, I'd love to save you some money. So if you ordered it now, you'll save the money, and you'll have the test when you come see me. Okay. Jana's asking if lungs can heal. Yeah, I mean, the same thing applies. There's no such thing as a disease that won't heal if we find out what the contributing cause and origin of the disease are. And I think, again, this is where fundamentally, and I spend a lot of time in the book, No Grain, No Pain, and I think it's the entire chapter 11. I talk about this concept, and sometimes it's better understood if you see it. This is called the triangle of health, and it's a fundamental premise and starting point for healing. And most doctors, I don't want to generalize and call most doctors bad doctors. I really don't believe that to be the case. I think we're educated at different levels and we're educated differently. And so I at no point tonight do I want anybody to think that I don't think that medicine can be necessary and that medical care can be necessary. I just think that the way that it's applied and the way that it's utilized is ineffective for the vast majority of people who are chronically ill. You know, medicine shines when somebody has an acute disease, but it fails and falls short when somebody has a chronic autoimmune condition. And so if we're looking at autoimmune disease, we start with this fundamental principle. And the DNA is at the core. And the reason why is your DNA is think of your DNA like a series of 23,000 light switches that can be turned off or on. And inherently, your DNA is not evil. You're not born with bad or evil or unhealthy DNA unless you're born with genetic diseases. And the vast majority of people are not born with genetic diseases. They're born with genes that are actually awesome. You've got awesome genes. Your genes, you're here and you're alive today because all of your ancestors prior survived everything that everyone else's ancestors who are dead didn't survive. So you're actually quite fortunate to have such awesome DNA. The key is that we want to understand that we can control what our DNA does. We can't change what our DNA is, but we can turn off and on the light switches of our genes with our choices. So I'm going to give you an example of the negative choice that would impact the DNA in a negative way. Don't exercise. When you don't exercise, you turn on genes that tear down your muscles because your body says, hey, look, you're not going to be using your muscles. You don't need it. We're going to take that protein and we're going to redirect that resource and use it somewhere else. So your body's smart. It's just adapting to your choices and adapting to your behavior. But if your behavior is a bad behavior and it goes on long enough, then the adaptation actually becomes the disease. And this is where people get into trouble. So there's three primary areas of control that we have: chemical, physical, and mental. And physical, there's this old saying, square tires don't roll. Structure dictates function. So somebody who's overweight, that's a physical problem. Somebody who has a severe scoliosis or has a degenerative disc in their back that's causing them to limp, those are all physical types of conditions. Somebody who has what's called intussusception, which is when their intestines tie themselves in a knot, that's a physical thing. It has to be surgically corrected. You're not going to supplement that or go gluten-free and fix that. It's a physical problem. Then there are mental problems. Some people are under too much stress, have horrible jobs, don't like what they do, aren't spiritually connected. And so emotionally, mentally, they're not fulfilled. And that can impact their health and impact the way that their genes are activated. And then there's chemistry. And I end on chemistry because I started this conversation by saying that the vast majority of medical treatments don't work for chronic disease because the whole premise is flawed and broken. And how do we know that it's broken? One, theoretically, it's broken. You cannot artificially change somebody's chemistry and fix why their chemistry is broken. It's just impossible. It's impossible to do, theoretical as well as in practical practice, in clinical practice. You can't add a chemical that manipulates and fix why it was broken in the first place, why the problem existed in the first place. This is medicine. It's artificial manipulation of chemistry. What you can do is you can ascertain a person's chemistry and you can start creating a protocol around what you design. And so the fundamental chemistry is loosely defined as anything you take in your body that helps you rehearse you. So it could be food, air, light, water, sunshine, vitamins, minerals, bacteria, infections, other things of that nature. So isolating and identifying these components first, as opposed to trying to mask the symptoms of these components, is infinitely more effective. And infinitely in the long run, it's much, much cheaper. A lot of people, one of the complaints about functional medicine doctors is they're expensive. But I had a patient a couple of years ago spent $80,000 in 1 year in the emergency room, and she spent a couple of $1,000s in my clinic and hasn't been back to the emergency room in 2 years. So I'd say I'm awful cheap, and I'd say she's saving quite a bit of money because the approach was meaningful. The approach actually had an outcome that fixed her problem at its core origin, as opposed to masking her symptoms and allowing her to have a false sense of confidence while her body continues to break down. So realize that you can't fundamentally fix anyone when you're artificially manipulating chemistry, and the statistics and the numbers actually prove this. If we look at medicine over the last 50 years, we have more drugs, more people taking drugs, more money being expended on drugs, more expense in the hospitals, yet we have more disease, and we're ranked number 37th in the world in terms of healthcare. So how is it that we can spend that much money and use that many drugs and have such poor outcomes? It's because the process doesn't work. Medicine is the only business that continues to grow by not serving its customers in a manner that's consistent with their healing and consistent with their ability to recover. So again, that doesn't mean all medicine is broken. Acute care medicine in our country is hands down best in the world. And there are certain scenarios and certain situations where, medicine is a necessary thing. But I think if we lose hope and doom ourselves to only believing that medicine is the only viable option for care, which so many people do incorrectly, so many people do just because they're undereducated or because they have such a paradigm and biased belief, and they just are refused to look at it in a different way. Well, they can refuse to look at it in a different way, and they can also choose to maintain their illness. That's just the way I look at it. So hopefully that's a little bit helpful in terms of concept. Okay. Somebody's asking me what I think of essential oils. I think essential oils can work really, really well as a tool to help a person, again, artificial manipulate their symptoms. I don't think essential oils are the cure. I mean, they can be in certain scenarios. Some essential oils are antibacterial, so if somebody's got a bacterial infection, they can be used in that manner. But I think if you're using essential oils as the main tool to block pain, as the main tool to boost immune function, then I think your approach is incorrect. I think you can use essential oils, and I think they can be helpful in part of a treatment arsenal, but they shouldn't be the only thing that you're doing. I mean, again, what do we want to know? We want to know why the pain is there. We don't want to know that, lavender or mandarin oils can help to relieve pain. We want to know why the pain is there. And if we can find that piece out, we can use essential oils to bring pain down and make life a little bit more bearable while we're ascertaining the origin of why the pain is there in the first place. Okay. Let's see here. I'm going to try to answer just a couple more. We're running behind. Mark asked, where can I find a doctor like you? There's not very many, Mark, to be honest with you. I've studied. I've got over 10,000 hours of clinical experience. There are doctors like me. They're probably all just as busy as I am, but probably the best place that I can send you, go to glutenfreesociety.org. That's O-R-G. At the top, it says GF Doctors, and click on that. There will be a map that opens up, and I train doctors all over the world. And one of the things we train doctors in is gluten sensitivity. And so the doctors listed, there will be several doctors listed on that website. But you're going to look for the ones with the little emblems that say Tier 1, Tier 2, or Tier 3, because those doctors have gone through some degree of parts of my program. I have a 2-hour and a 10-hour online educational aspect or postgraduate program that doctors can train through, and then I have an experience-based platform training that doctors can go through. So the higher number the tier, the better the doctor's experience. So that's where I would ask you to start, and looking for somebody who's versed in a similar fashion as myself. Okay, let's get in one more question here. Somebody's asking about MTHFR, homozygous MTHFR. MTHFR is methyl tetrahydrofolate reductase. It's a gene. A person can have a variation in this gene that can make it harder for them to metabolize folate and harder for them to go through this process called methylation, which is very critical for making neurotransmitters and detoxification, and also very critical for hormone production. But I think too much weight is put on the back of MTHFR. MTHFR is just one gene. And generally, even if you're homozygous, meaning that both pieces of your gene are mutated, that means that gene works about 40% less effective than somebody who has no mutation. Even if you have a homozygous, you can still bypass that and get around that relatively easy. But I would recommend that having a deeper investigation, because just knowing whether or not you have an MTHFR mutation, you can go wrong. I mean, some people will supplement with methylated folate, or what's called 5-MTHF, 5-methyl tetrahydrofolate, which is a good supplement that helps with that gene variation, or that what's called a genetic SNP. But some people have other mutations, so if some of these other methylation mutations, non-MTHFR mutations, can pose different kinds of problems for people, so that if you're taking that methylfolate, it might not be effective, or it might actually send you in the wrong direction. So my advice is actually to have your full methylation genetic panel done. Find a good doctor who's got good experience in interpreting those results. A lot of people go online and get these kind of pseudo interpretations of these results, and the information is very vague and it's very non-committal. And if you're dealing with that, you're not really going to get a whole lot of lucid answers, and it's just going to be a frustration. So my advice would be to get the whole methylation panel run and have somebody who's worth their salt interpret the results and give you guidance and feedback on what you should be doing, based on a multitude of variations, not just one, because it's very rare that just one small mutation is going to make or break your health. It can happen, but it's not that common. And even with MTHFR, I mean, I have seen cases of MTHFR mutation where there was tons of problems, and supplementing did help. But usually, what helped more was identifying food allergies and identifying other lifestyle factors that would basically help that person's overall health, so that the MTHFR mutation was less problematic for them in the long run. Okay. Anthony's asking, and this is a great question. I think I'll finish up with this question. Well, let me answer Margaret's question. The site for finding the doctor is glutenfreesociety.org, glutenfreesociety.org. And then I have a couple of different doctors who are listening in tonight who want to know more about the types of testing that I use in my clinic, and then the way about our approaches and how we approach patients and patient care. That's a huge conversation. We don't have time to get into the details of that tonight, but I don't want to leave you hanging either, because as a doctor, I want to put the right tools in your hand so that you can help more people. What I will encourage you to do, I'm putting on a seminar in April. Actually, I'm sorry, it's not April, it's March. March 18, 19, and 20. It's called the Functional Medicine Success Summit. And this is where you can learn all the minutiae and all the details about protocol and about how to get moving in that right direction with your patients and learn more about what we do. It's a 3-day event, and I've got a lot of really stellar physicians that are guest speakers as well as myself. So I'd highly encourage you. It's functionalmedicinesuccesssummit.com. Go there, make sure you attend it. Come say hi to me. I'd love to sit down and chat with you when you come. So hopefully that's helpful, and we'll get you moved in the right direction. So before we end tonight, I'm just going to reiterate, I really appreciate all of your support and all of you being here. If you don't have your copy of No Grain, No Pain, do me a favor, go buy it. Go buy it for the value of this webinar. Go buy it because it's going to help you. Go buy it if you know somebody with autoimmune disease, and give them a copy if you know it'll help them. Help my mission, help support my mission. You know, all the things that I do, all the things that we do, all the outreach, all the stuff that I do. You know, I get paid to see patients in my clinic, but I don't get paid for nights like this, and I don't get paid. I don't get paid to spend 8 months writing a book, and I don't get paid to spend countless hours of research putting together resources like Gluten Free Society for you. So if you, as you're supporting those, just know that I greatly appreciate that. These things cost a lot of money to run and to manage, and so I'm just grateful for your support. If you can offer it up, it's greatly appreciated. And take advantage of that Leaky Gut manual as it's there, because I think that goes away February 8th. So if you want to take advantage of that bonus, grab it before the 8th of February. So I want to thank you all for tuning in tonight. We're gonna sign off. I will post a replay of this sometime within the week, so that if you want to go back and take notes and review it, you have the ability to do so. And again, I thank you so much for tuning in and being here. For those of you in the Houston area, if you are in the Houston area, I'd encourage you to come on Saturday. I'm doing a lecture at Barnes & Noble out here in Sugar Land, and you can come by for that. We're going to be doing a book signing. We're also going to be doing a presentation about gluten and hormones. So if you are in the area and you want to come, feel free to drop in. If you know somebody who could receive benefit from being there, make sure you bring them along. And until next time, I hope you wish you the best and the most prosperous health in life, and wishing you nothing but the best. Take care. I'll talk to you next time on the next presentation. Bye-bye.